News broke on Monday the Southern District has the highest rate of new hepatitis C infections in New Zealand. The South also has a high rate of treatment for the disease, and Associate Professor Michael Shultz is here with the background to the issue. Good evening, Dr. Shultz.
Good evening, Rebecca.
Tell us a bit about the figures that we've seen this week. What are they and what do they mean?
Well, the figures are certainly alarming, I think. I mean, the South is the region with the highest rate of acute infections, but mind you, it's only the acute cases that are being notifiable. So a lot of these cases are actually not acute cases. They are cases where, when we look into the background a little bit, they have been chronically infected, these patients, and they are being then notified as acute cases. So the number is high, and we need to do something about that, yes.
Now, there are some misunderstandings around about this disease, I understand. Can you tell us about those?
Well, when you read the ODT, the article you're referring to a couple of days ago, it was talking about carriers. And I think a carrier of hepatitis C, this is just belittling the problem. A carrier is an infective person. So that person is not carrying the disease just like you or I would carry a backpack. This person is infective to other people. And I think the word carrier is just not taking justice to that.
What are the effects of hepatitis C?
Well, the effects are, and that's actually the big problem, Rebecca, the effects are quite variable. I mean, there are patients out there who just have no effects whatsoever, so they feel very healthy. Other patients will go into liver failure, they will actually go into developing liver cancer and could die of this disease. And that happens over a time frame of maybe 15 to 20 years. So the spectrum of symptoms is extremely variable. About 10% of patients only have symptoms when they get acutely affected. The other 90% will not know they got infected.
How is this disease treated?
Treatment at the moment is with a subcutaneous injection of interferon once a week and tablets twice a day. And then depending on the genotype of the virus, and there are several genotypes out there, it's a treatment of 24 to 48 weeks. So it's quite a demanding treatment. It demands a lot of compliance of the patient, and some patients do have quite a lot of side effects of this treatment. So treatment is difficult. If you want to inquire about success rates, now success rates are between actually 50 and 80%. And success means we can clear the virus and this patient is totally healthy afterwards.
Now, there has been a study to discover the extent of the disease locally. What was the result of that? The
study was performed by one of my BMed Sci students 2 years ago in 2011, and the result was even more alarming. We looked at 40 to 59-year-old patients, or they weren't patients at that time, people, basically the baby boomers, and we found about 3 to 4% of these people being infected with hepatitis C. And this is obviously much more than what the general perspective is, or the estimate of 1% to 1.5%. That was one result which is alarming. This was gained by testing anonymous blood samples, so these patients were having a blood sample for other reasons, so it probably is a little bit biased. They weren't healthy people. The other result is that education is a big gap. There's a big gap in education. A lot of people just don't know how to get hepatitis C, how to test for it, and how to treat it, and how to protect others from infecting others.
What more do you think needs to be done to deal with the disease?
Well, certainly, as I just said, education is a big point. We need to really educate people about risky behavior. This is tattooing, this is piercing, this is injecting drugs, obviously. Also about being careful when dealing with patients that were injured and you come in contact with blood or anything like that. We need to make doctors aware, GPs aware of the fact that hepatitis C does not need to go along with symptoms. So patients that engage in risky behavior should be tested and then should be referred to us for treatment.
How successful are we in dealing with it?
Dealing with hepatitis C or dealing with the education?
The response.
Well, the response, I think, to these measures is reasonably good in the South. We have a very high number of patients that we treat. We have now engaged with the prison service, and we go to the prison services and treat patients there. There's an extraordinary compliance in the prison population to treatment, so this is fantastic. But I think lots more needs to be done.
Associate Professor Michael Shultz from the Dunedin School of Medicine, thanks very much for your time.
Thank you.